This was the repeat question. They had given an X-ray of a free gas under the diaphragm. This has come in the previous paper also. So it was a hollow viscous perforation, or some students said the option was perforative peritonitis. Doesn't matter. It was a free air under diaphragm image, right? So that was a straightforward question. Okay. This actually is not very ambiguous, but I will tell you the logic behind this question. They had explained the scenario of achalasia. Always say young patient with a dysphagia, initially more to liquids. So they had given a scenario of achalasia and they had asked what will be seen on barium swallow. Rat tail, smooth filling defect, irregular filling defect, or corkscrew esophagus. Now, irregular filling defect will be seen in cancer. Corkscrew esophagus will be seen in diffuse esophageal spasm. Most students are saying smooth filling defect. That is not the answer. Answer is going to be rat tail. Okay, rat tail or bird beak are both okay. Bird beak was not there in the option. Rat tail was there. That is still the answer. Smooth filling defect will be seen in benign tumors. Okay, smooth filling defect will be seen in benign tumors of the esophagus, like a leiomyoma. Right? So that was the next question. This was another normal expected question. We have done it many times. Patient presents with absolute constipation, means he is having obstruction. X-ray was shown and the X-ray was like that typical coffee bean appearance. So coffee bean appearance is going to be sigmoid volvulus. Other options I don't think you need, but they were also in context of other types of intestinal obstruction only. So this was straightforward, sigmoid volvulus. Again, a repeat question. This has come 3-4 times. They gave the classical history where patient had alcohol and then he had epigastric pain radiating to back. I don't know if they had given any more pictures, any more findings, but it was something of this type only. So this is going to be acute pancreatitis. Not this pic, but it was a similar pic. It was coffee bean only. And patient had absolute constipation. So coffee bean is going to be sigmoid volvulus. Paralytic ileus, they won't ask you unless they give history of a previous surgery. Okay, if they ask test, that will be amylase lipase, no problem. They didn't ask diagnosis, they had asked the test, it will be lipase amylase, fine. But normal question, right? Means it's not something where you had to think too much. Right? It was amylase lipase. They were talking about diagnosing pancreatitis. Correct?